I appreciate it. I'm going to go through a number of slides pretty quickly today to talk to you about our program, SMI Advisor, and sort of how to use it. But I want you to really just kind of take it in. Here's our website, SMIadviser.org. And I'm going to roll through it, and there's going to be a number of ways we can help you. You can either, I'm going to walk you through our website, but I'm also going to show you how you can send us a consult where we can help you directly. As Elijah said, I'm a clinical psychologist. I'm actually located at the American Psychiatric Association, and really proud of the work that we're doing here on SMI Advisor. Happy to share it today. So as mentioned, we are funded by SAMHSA, which is a division of DHHS, and we are located at the American Psychiatric Association. I have no disclosures or relationships or conflicts of interest related to this presentation. So SMI Advisor, what are we supposed to be doing? Well, what we're supposed to be doing, and I'm really speaking to the choir here because many of us on this call are doing this. But our goal at SMI Advisor is to transform care for people who have serious mental illness so they can live their best lives. Now, serious mental illness, as we know as clinicians, can be defined in a number of ways, but we use the definition from SAMHSA, which is major depression, bipolar disorder, and schizophrenia. And we're a national initiative. And we really serve the whole mental health practice team. So that might mean psychiatrists, psychologists, social workers, licensed counselors, maybe peer specialists, and it may be administrators. So we're reaching out to the whole team and defined broadly in the hopes that working with those individuals will eventually change care for this population that we are so concerned about. So SMI Advisor offers 3 assets that are available to the field. And I'm going to go through each of them, but educational opportunities, vetted resources, and consultations. So what I mean by educational opportunities are things like 1-hour webinars, they may be town halls, they may be 12-week deep learning collaboratives. Vetted resources, well, we can all Google all of our questions or ask our friends down the hall at the water cooler. But what we mean by vetted resources is we take in resources that are in the field and we vet them through 2 clinical experts to ensure that they are applicable to the SMI population, applicable to frontline clinicians, and also of the latest evidence. And then consultations, I'm going to go to in detail, but these are things that you can take advantage of. If you just need someone to ask a question to, we're here for you. So here's our website, SMIadvisor.org, and I'm going to walk through each section. And the first one I'm going to walk through is the section on the upper left here called Clinicians. So if you click on Clinicians and you go to Education Catalog, this is where you're going to find all of the accredited webinars. These are all live, but we also tape them and they're available as enduring for use whenever you want. They are all accredited for CME, but many of them are also accredited for psychologists, social workers, and nurses. And you can see when you look on the website what the accreditation is that's available. So you can see down here what you've got. They're all about 1 hour. And those that are enduring have a short quiz after them to claim credits, but those that are live, there's no quiz. So it's always advantageous to be on the live one. And we have over 350 of them already. So this is a really good resource for a lot of your team who are looking for free CEs and also for information around serious mental illness. We also have virtual learning collaboratives. These are really meant for a smaller cohort of people, usually 15 to 20 individuals. It's led by someone on our clinical expert team, so a clinician typically. And the point is to work on a topic and really to have something to take back to the place that you practice. So for example, one of the ones we had last year was called peer specialist, from position description to integrated team member. So people in this group, some of them were working on position descriptions for peer specialists. Some of them were working on 30, 60, 90 plans for onboarding peers. Some of them were working on supervision of peers. So there were a lot of different things that different people were working on. And again, hands-on, it was led actually by an expert in peer specialists, and just really useful. So these really give you something to take back home. All right, what about the calendar? The calendar is where you go for upcoming accredited webinars and virtual learning collaboratives. As you can see, it'll show what's coming up in the current month, and you can just press on those and register. Knowledge base. This is where you're going to find your vetted resources. So we have over 1,000 evidence-based resources in our knowledge base. There's a search engine, but we also have them organized by topic. So you can see here some topics that are in there: clozapine, manualized psychotherapies, comorbid medical conditions, peer specialists. And under each of them is an active link that you can go to the resource. And for each resource, there's a very short 2 to 3 sentence summary of it. So you don't worry, you're not going to go to this and see a big JAMA article and have to read a 15-page article to figure out what's going on. We summarize it for you. And then if you want to go to the full resource, you can go to it. There's a link to it, but we try to summarize it for you. And it also tells you who wrote the summary and when they wrote it. So you can know who's vetting the things that you're looking at. I want you to know that our resource knowledge base has some things that exist already, but we've also developed some new resources. Why did we develop them? Because we saw gaps. So for example, there actually wasn't that much surprisingly written about suicide in SMI, which kind of blew my mind, but we wrote something about that. And so we have that there. We wrote it with the SPRC, which is the Suicide Prevention Resource Center. We also have a number of series on myths versus facts, one on psychopharmacology, one on treatment, one on recovery. We have some on what is AOT and what is AOT not, and a glossary on AOT. So there's a number of existing and new resources in the knowledge base. Now, we have 2 apps that I want to introduce you to. One app is what we call the SMI Advisor app. The SMI Advisor app, again, free download in the Apple Store or Google Play Store. The SMI Advisor app has everything that the website has, plus a number of rating scales. The PHQ-9 is in there, the GAD-7. We actually just added the Audit C this last week. And what this allows you to do is be in the clinical encounter. You can answer the questions with the client right there. It automatically scores and automatically gives you an interpretation of that score. And just this last week, we added the ability to download a PDF of their answers to each question and the interpretation. This allows you to put it into your medical record or print it out for the client so that they can follow along over a number of weeks how they're doing. So the app is really your place to have something in your hand that allows you to do some sort of measurement-based assessments during the clinical encounter. The other, and here's where you can find it, smiadvisor.org/app, or you can go to the Apple or Google Play Store. The other app that we have is the My Mental Health Crisis Plan app, also available same places. And what I want to tell you about this is an app to help someone build a crisis plan and turn it into a psychiatric advance directive, sort of a legal crisis plan with attention to the requirements of their state. So you can go through and answer for yourself, like, who do you want called? What medication works for you? How do you feel about seclusion? Is that something that's helpful to you? Something that really is not helpful to you? You answer a number of questions, and then you say, what state do you live in? So you pick Ohio, and it tells you exactly what's needed to make it a legal document in Ohio. It may say that you need a decision maker to sign. The decision maker can sign right in the app. Then it allows you to share your crisis plan or psychiatric advance directive, if you've made it the legal part, with anyone you want as the client via QR code, or you can download a PDF. And so that allows them to share it with maybe their treatment team, or if they want to share it with their parent, or they have a partner, or they have a confidant, a spiritual advisor that they'd like to share it with, anybody who might be helpful if they are in a crisis. And I think this is going to be really important. I mean, it's always been important, but we're at that moment with 988 coming that crisis plans, I hope, will be really utilized. So as I mentioned, it's very easy to fill out. It's at like a 7th grade reading level. Here's what the QR code looks like when you want to share it at the time. And you can find it at smiadvisor.org/PAD app. Now, one thing I'll say about my mental health crisis plan was that we built it with something specific in mind. And that was, we didn't want any data held in the app or in the cloud. So it doesn't go anywhere. So I say that for 2 reasons. One, if you want to go to /PAD app, download it and see what it's about, make one. Make one for Darth Vader, make one for Minnie Mouse, make one for yourself, just to see how it works, because it's not saved anywhere. Okay. When you exit out of it, you can go back in and make a new one. It also allows you to make one for a client and then transfer it to their phone. So you could facilitate someone making one. So there's a lot of good with that. It means that it's not somewhere. So it is really important for when someone makes this, for them to share it with someone so that somebody else has it in the moment of crisis. All right, consult request. I sort of hinted at this at the beginning. Let me go back one. We are one of the only centers at SAMHSA that takes consults. So we take consults from the field, and to date, we've answered about 2,800 consults. It's very easy to enter one. And I think it's really a great service of SMI Advisor. Let me tell you a little bit more about it. So we see consultations on a continuum. Your consultation that you might put in might be a very brief answer from us. You might say, for example, we have a new cohort of psychiatric fellows, and we would like them to learn a little bit about AOT. Do you have a slide set on that? Or do you have any handouts on that that could be helpful? That's an email back. We'll send you an email with the resources that we think might be helpful. You might write in and say, I'm trying to sort of get measurement-based care stood up in my clinic, and I'd like some training on the brief psychiatric rating scale. That one might be a live discussion where we go back and forth, we make a plan, how are we going to do that? You may have an implementation site project. This is a kind of in-depth consultation where we may visit your site, where we may work with you over 6, 8, 12 months to make a change that you want to change. Maybe you're starting collaborative care. Maybe you're a rural site who needs more in-depth training. So we see consultations on a continuum. So you might write in with any level of continuum of consultation, and we will work with you to resolve that. So this is what the consultation part of the website looks like. You can see that you just create an account, and then once you have an account, you can return as many times as you want. You can ask about psychopharmacology, recovery support, family engagement. And during the work week, we answer within 24 hours. So that's the beauty of this kind of consult service is if you need an answer now, we got it. So give us a call. This is the group who answers the clinical consultations and who's sort of the brain of SMI Advisor. If we don't have someone on our team who can specifically answer the problem that you've written us about, we will get them. And so, for example, if it's a criminal justice involvement question, we have Deb Pinels on contract, and she's an expert in psychiatry and the law at University of Michigan. If you want to do psychosis, gold standard measurement, we work with Joe Ventura at UCLA. So these are sort of the first line defense. And then we have a whole ripple of second wave of people who can help with consults. So let me tell you a little bit about a few specialized resources that we have. And these are all typically found under the tab that says Centers of Excellence. So we have a Center of Excellence on clozapine. This is led by Rob Cotes from Emory and also by Nashville. And it's a really active group. And Rob Cotes is also on the FDA stakeholder panel for clozapine REMS, which is the registry for REMS. So we are well involved in all aspects of clozapine rollout, implementation. And so I recommend visiting the Clozapine Center of Excellence and being part of this community if you're interested. We also have a long-acting injectable center of excellence. This is led by Donna Rowland, our nurse practitioner. Really interesting group, also very active. Together, the clozapine and LAI communities have what we call a Center of Excellence exchange. There are over 480 clinicians on this. And it's, again, very active. They talk about dosing, they talk about cases. People write in and say, I just saw a patient with this, this, and this. I was thinking of starting them on this for this side effect. What do people know about this? How should I titrate up, et cetera? So very specific questions are answered on this exchange. It is moderated so that no misinformation's on the exchange or answers that we don't feel comfortable with. So we really want the moderators who are psychiatrists and nurse practitioners are making sure that each response is aligned with the evidence base. We also have a clozapine and LAI, what we call virtual forum. These are 30 minutes to 45 minutes where we take a hot topic off of the listserv in the last month and go into a deep dive on it. So these are, you don't have to sign up, there's nothing to do, but if you're on our listserv or you're on our newsletter, you'll get a information that the clozapine LAI topic for this month is X, and you can decide if it sounds good to you and it fits into your schedule. If not, no big deal, real easy to join. We also just stood up a digital health community of practice. As we know, for decades now, we've been trying to move telemental health along. And one of the great side effects of the pandemic, if we're looking for some silver linings, has been that digital mental health and telehealth has really moved along. Especially in the population with serious mental illness, we've always been a little bit slow on this, thinking that maybe they couldn't do it, they wouldn't have the resources, et cetera. And we've really made some big movements in that. And this digital health community of practice meets once a month or once every 2 months. And it's led by the director of digital psychiatry at Harvard, and also paired with a social worker from Chicago, where they really talk about how, apps and digital mental health, wearables, how do you use the data? How do you get the data, et cetera? And so this is a pretty active new group that we've just recently stood up. We have a COVID-19 resource center. This was really active 2 years ago and is now really moved into reopening practices. What do you do? How do you decide if you should keep a particular client on all telemental health, or that they should be someone who should do hybrid, or someone who needs to come in every week? So how do you make these decisions? How do you work with your front end staff at the clerk's desk with clients coming back who maybe don't want to wear masks, have questions, et cetera? So it has resources both in terms of talking to people about vaccines, but also reopening practice, and a lot of good stuff in here. And then, as I mentioned before, a good amount of stuff on AOT. Now, AOT, people have a lot of feelings about AOT, whether it's person-centered or not, who should get it. And there's a lot of feelings about it, which I understand. We really try to present all sides of AOT. How can we work with this system to help our clients actually eventually get to their recovery goals? So we have a nice section on assisted outpatient treatment. I'm just in these last few minutes going to run through some resources we have for individuals and families. In the SAMHSA centers, of which we are one, there are very few that have both a clinician side and an individuals and family side. We are one of those. And I would say, don't in your mind think I'm a clinician, so I don't go to the individuals and family side. There are a lot of things on the individuals and family side that are great handouts for your clients, or great videos you might want to point a client or their family to. So I would recommend nosing around the individuals and family side as well. So just to the right of the clinicians, there are over 500 resources on this side. So there are whiteboards on how do medications work. There are a lot of testimonials. This whole side was built with NAMI, with NAMI's help. Like I said, there's a number of animated whiteboard videos like, are you born with it? The biology of mental health conditions. There's certain ones on how psychotropic medications work. What does it mean when I have a new diagnosis? How does my brain work? So these are really nice. There's also a number of testimonial videos, one on clozapine, one on support system. I actually love to send new psychiatry fellows, new psychologists to the video on working together with clinicians. It's a panel presentation by people with serious mental illness saying what they wish their clinicians would ask them. And I think that's just so powerful. It's good for senior docs too, but they don't tend to want to watch it. But definitely for our fellows and our interns, it's a great one to watch. We have a lot on Words Matter, and I know Elijah at the beginning brought up how important it is, Words Matter, and that the MHTTC uses those as well. We have one specific to serious mental illness. And then, of course, we have a number of fact sheets on different disorders, crisis preparation, suicide. And I'm going to stop there. I know we just lunch and learn is a short meeting. I have my email address here, acohen@psych.org, and our website, smiadvisor.org. Happy to, I saw a number of the questions that you put as you registered today, and I would really encourage two things. Either nose around our website. In our knowledge base, we have a number of these topics that you mentioned: peers, criminal justice, non-compliance, how to work with hallucinations. What about older adults with SMI? Staff burnout, how to integrate with primary care. These were all great questions. We have a lot of resources and webinars on these. But I would say, if you're thinking to yourself, great, I don't have time for that, send us a consult. We'll find it for you. We'll cull our knowledge base and find what you need. So we know you're busy, and we want you to have as much time with your clients and their families as possible. We know that's important. So if you have a question, know that we have it, hopefully. And if we don't have it, we'll find it for you. So remember, you go to the website, pick clinicians, go to consult and enter a consult. And again, we answer in 24 working hours. So we're here for you. I'm so impressed with the work being done in the Great Lakes region in Ohio. And I'll stop there. Thank you so much.
Thank you, Dr. Cohen. Really great information. I can also share that, I've looked on that website before and gotten some information, especially around AOT, because one day at my previous life, it was dropped on my lap, and I'm like, what is this? What does this mean? We have a couple minutes for some question and answers. Someone did ask if you'd be willing to share the slides that you presented.
Sure.
Okay.
Sure. I'll send those to you, Elijah, and you can share them. No problem.
Yeah. And then do you have any marketing materials similar to the one pager for this app?
I will get that to you as well. So let me just write that down, and we can get that to you. Katie, thank you for asking that question. Marketing materials on the app. And did she want that for the, I'm assuming for the My Mental Health Crisis Plan app? I will get that. Yeah. Yep. I'm assuming it's not the app on the website, because that's the same thing.
Mm-hmm.
Any other questions? I know we're right at the half hour, so. Again, you can email me at acohen@psych.org, visit us and send us a consult. We are here. Put it in your phone. And if, in a couple months from now, you think of us or you have new cohort of employees or anything, we're here to help you.
Yeah, and while you were talking, I'm sure many people work with students. This is a great source for students too, who want evidence-based information while they're in their training program.
Mm-hmm.
So, if you're working with students, this is definitely something to share with them as well. So,
I'll just say one thing, and I'll put it in the chat here. We actually just last night stood up a new microsite called SMI 101. And this is great for students, but it's also great for established providers who are starting to see more people with SMI, or who or new trainees, any of those. It has all the kind of basics. And so I would encourage people to share that microsite with folks who are trainees. For some reason,
But I think we don't have any other questions. So
Okay.
thank you so much. I'm going to go ahead and stop this recording.